Hi everyone, my name is Nas Videric and welcome back to our lesson today. I acknowledge you for your presence here, and today we'll be enlightening on a good topic which is affecting most of our ladies in the society. And the topic of the day is about candidiasis. Candidiasis, it is an infection, or also you can call it a yeast infection, that is affecting most of our ladies and women today. With the research which was done by WHO in the year 2023, it purported that candidiasis normally affect around 28% of the women worldwide. You can just imagine you are counted in there when you're getting that infection. And it is so disgusting, and at some point you are not even comfortable when you're having this condition. A normal vagina should be moist, it should be warm, and also it is acidic in a way. That means it has a pH of 4.5. It is slightly acidic. So when you can just imagine when these normal conditions are variated, definitely you're going to get an infection, which in the discourse you can get candidiasis. This candidiasis is caused by a yeast called Candida albicans. And do you know, Candida albicans, it is a normal flora in the body. That means it is a normal bacteria or a yeast in the body. So when this normal yeast in the body is disrupted or it is derailed, definitely you just get this disease. And when you get this disease, you are not comfortable due to the signs and symptoms it normally present with it. And the causes of this disease is when you're not even keeping yourself hygienic. I know when I speak about hygienic, ladies, you should understand what is hygienic. And secondly, when your immune system is very weak to support you or to fight for you from different infections, like people with tuberculosis, people with HIV and AIDS, people with cancers, your immune system is compromised. So you can just imagine when your protectors or your body shields have been compromised, definitely you're not able to take care of yourself. And you just imagine when this Candida albicans, which it is actually a normal flora in the gut, in the perineal area, that is the vaginal region, and in the skin, when it increases beyond normal levels, you're going to get this disease, which is so disgusting and uncomfortable at some point. Another cause, because we've said when you are not hygienic well enough, definitely you just get this disease. Another cause is when you're taking a lot of sugars, for example, carbohydrates or so. When you take a lot of sugars, you're just giving this yeast infection an area to thrive each and every day. Another cause is when, for example, you've just come out from the gym, you are just swimming with friends or so, and you've not even changed your wet clothes. Definitely, you're just going to infect this. You're going to get this condition. Another factor that brings about this disease is when you are pregnant. Because when you are pregnant, there are some hormones that normally increase the body. For example, the estrogen hormone and the progesterone hormone. But mostly the estrogen hormone is used to maintain pregnancy. So when this estrogen hormone increases in the body, it normally releases a certain enzyme which shield the Candida albicans from being affected by the fighters in the body. So when this Candida albicans has been shielded, definitely your body is not going to fight for you, so as this Candida albicans might not affect you. Another factor is these people who normally use these artificial contraceptives. For example, the Femiplan that you go in the hospital, in the facility and receive. These family planning pills, or these when you decide to take a combined contraceptive pill, it has two hormones, which is estrogen and progesterone. The same way when you are pregnant, there is increase in the estrogen hormone in the body, you're going to be infected because the estrogen is going to shield you. The same way these COCs or these contraceptives are going to affect you. And the signs and symptoms of this candidiasis, one is having a burning sensation when you are urinating. You should not, actually you should distinguish this condition with a urinary tract infection, because many people with urinary tract infection, they normally have a burning sensation when they are urinating. Another symptom that brings about this disease is vaginal discharge. So you can just imagine you having a very heavy vaginal discharge. But the good thing with vaginal discharge for candidiasis, it actually differentiates itself from sexually transmitted infection. Because in sexually transmitted infections, for example, gonorrhea and like syphilis and chlamydia, they have their specific vaginal discharge. But for this candidiasis, it is white and cheese-like, white, cheese-like, and lumpy, compared to that of gonorrhea, which at some point it is yellow, greenish, it is scary a lot. But for candidiasis, it is white and what? And lumpy and cheese-like. So you should be able to differentiate between the STIs and the candidiasis infection. Is itchiness around the perineal area. You just sit in, you just sit around, sit down, and you start itching yourself in the perineal region. So for you to manage this condition, I will not tell you the medication that you're going to use, but it is good when you start getting these signs and symptoms, or they start appearing in your body, like burning sensation when urinating or during intercourse, when having a vaginal discharge, when having itchiness around the perineal area. Kindly go and reach out to your doctor. Don't sit around and prescribe the medication for yourself. So, how do we prevent this infection? Ways to prevent this infection: one is adhering to the protocol or to the regulation where you can prevent this disease. First thing, don't use a lot of antibiotics, by the way, because there are some antibiotics, for example metronidazole or fragile. So this antibiotic normally kill the bacteria, as the name suggests, of the gut, but you don't know the side effects of the bacteria of the antibiotic. So do not use over-the-counter antibiotic medication, by the way, because they will bring a lot of detrimental effects in your body. Another thing, when you come out from the gym or from swimming with friends, don't stay around with those wet clothes. They may bring a lot of issues to your body. Another factor is maintain a good hygiene, especially ladies. Maintain good hygiene for us. You can prevent this disease, because some of the ladies prejudice their men or their partners that you cheating on me, you acting infidelity, so you bringing this condition to me, but you might not be hygienic, wiping yourself clearly, and you prejudice this man that they are bringing this condition to you. So guys, try to adhere to those preventive measures, because I just told you the causes. The causes are when you are pregnant. You will not avoid being pregnant, and at some point this is not the main factor, but there are other aggravating factors, like using a lot of sugars. You are not maintaining hygiene, you're not removing these wetty clothes. And also there are ladies who don't like wearing this cotton underpants or innerwears. So these cotton innerwears, by the really help a lot, because they absorb a lot of things which will not go to adhere your body. So please try to adhere to the regulations that I have told you. And thank you so much guys for watching this video. I would like you to follow me in all the social media platforms like TikTok, and as well you can subscribe in my YouTube channel. It is called Nas Videric. Follow me on TikTok. I'm also Nas Videric. Thank you so much. You can like this video and share to a lot of people so that they can understand what is candidiasis and how you can prevent this candidiasis. Thank you so much.